Dr. Pavish noticed blood in the urine bag of a woman who had undergone a C-section. He quickly informed the attending physician about the situation. However, the attending physician simply said it was normal. He mentioned that he had delivered thousands of babies, so everything was under control.
So leave my patients to me.
But soon after, the woman started experiencing stomach pain. Seeing her lying in discomfort, her husband rushed to the front desk for help, but the nurse, unhurried, told him to wait. Before the man could finish speaking, she told him that his wife just needed some sleep. The man, concerned, insisted something was wrong. The nurse, however, started answering phone calls to help others. Left with no choice, he walked away in frustration. Later, Dr. Pavish also approached the nurse, but she said they were short-staffed and overwhelmed. Dr. Pavish noticed this was not true. Frustrated, he stated that all patients should be treated equally. He then went to check on the woman himself. By then, there was even more blood in the urine bag. He called the attending physician again, explaining the situation. The woman was in immense pain, but the attending physician still refused to examine her.
Tell me you are not that guy.
That isn't offensive. That is a ridiculous accusation. As soon as I get out of surgery, if that's all right, Dr. Pravesh.
When Dr. Pavish urged for a CT scan to be arranged, the woman's condition worsened. She was cold all over. Dr. Pavish asked the nurse to call the attending physician immediately. When the physician arrived, he found that the woman was suffering from internal bleeding. Her condition was critical and she needed surgery right away. It was only then that the attending physician panicked. In the operating room, the woman was bleeding heavily.
How long ago was the C-section?
6 hours.
What? What the hell happened?
The surgery finally ended. By this time, the attending physician realized the gravity of his mistake. An outraged Dr. Pavish confronted him. If the patient weren't black, would this have happened?
This happens far too often to women of every color.
But it's 4 times more likely to happen to black women.
Meanwhile, the anxious husband, still unaware of the tragedy, waited. When he heard the doctor's announcement, he finally broke down. After everything was over, Dr. Pavish reported the incident to the hospital director, but the director insisted it was just a major mistake, claiming there was no racial bias or prejudice among the hospital staff.
That's not my son. A mother knows, a mother can tell.
Leonard's mother suddenly no longer recognized him. She said her son had gone to summer camp weeks ago and had never come back. Then, the boy suddenly appeared at her home, claiming to be her son. After a CT scan, the doctor diagnosed her with a rare condition, Capgras syndrome. This illness caused her brain's facial recognition system to fail. Since the issue was internal in the brain, surgery was not an option. Even medication could only delay the symptoms.
Linus, there's no easy way to say this. Your mother is never going to recognize you again.
Iggy felt helpless in the face of this condition, but then he had a sudden idea.
Therapeutic fibbing, that has had great success in similar syndromes.
So he told Leonard's mother that her son was already dead. Upon hearing this, she was very sad, but at the same time, she felt a strange sense of relief. Iggy then mentioned that there was another person feeling sad, going through a similar experience, and asked if she would be willing to talk with him. She gets very emotional when Leonard shows up and tells him to leave. But he said he'd lost his mother too. He wished he could talk to her. And then he talked about all the things he had done with his mother. Although they could never restore their previous relationship, they could begin to forge a new connection. Dr. Shepard actually performed a private sterilization on a woman after she delivered her baby. It was unbelievable to her assistant. When the woman woke up, she handed her the baby and said that she had damaged both tubes due to complications, which means she never be able to have children again, and the woman said,
"Thank you, Dr. Shepard."
The assistant was very angry and questioned her, but she said,
"She is our patient. Our obligation is to her, and her only."
It turns out she was already a mother of 6 when she came to the hospital for her checkup. 6 children in 10 years. She was even on birth control for 4 years. She said she looked like a big cow, so she asked the doctor to secretly perform a sterilization while her husband was away. She said the years of pregnancy had been very painful. Broken bones, 3 hospitalizations for overwork, 3 C-sections, and a growing number of children in her care. In order for her husband not to find out, she was able to pay for the surgery privately instead of reimbursing the insurance company. The assistant was upset and said,
"Your husband's not abusing you, and you don't get to lie to him and blame it on the Pope."
And Dr. Shepard told him that he just needed to do his job. They just have to serve their patients without saying anything. When the woman is examined again, the assistant continues to speak out and stare at her in an unfriendly manner. It made her feel very uncomfortable, but in the end, she insisted on having the ligature done. So Dr. Shepard secretly performed the procedure later. But afterward, the woman couldn't help but tell her husband about her complications. And when he asked about it, the assistant doctor told him to get a lawyer, which made Dr. Shepard very angry. But the woman said she just had to let her husband know that they weren't going to have any more children. And Dr. Shepard said it was a matter of her reputation as an obstetrician. She had to tell her husband the truth, but then she said,
"So sorry. because I am so grateful to you, but I can't tell him.
54-year-old pregnant woman faints. The doctor rushed over to check on her. When the doctor asked her daughter if she could contact the father, the daughter said the baby was hers and her husband's.
My mother's carrying our baby.
It turns out that due to their financial reasons, they couldn't afford a professional surrogate, but a pregnancy at this age is too old to maintain the health of the fetus. Besides, she was a heavy drinker when she was young. That's why she passed out with atrial fibrillation. Dr. Choi recommended conservative treatment with medication, but Dr. Will insisted on electrotherapy, but after a lot of treatment, neither the medication or electrotherapy had any good effect. She almost died 3 times in 1 hour. Dr. Will decided to go aggressive with the tetracaine, despite Dr. Koi's strenuous objections. Dr. Will explained that this drug could possibly cure her arrhythmia. If it failed, her heart would stop. But the mother asked if there was any way to keep the fetus alive if she died. And when she got an affirmative answer, she decided to use tetracaine. When she was young, she was often drunk and away from her daughter. Her daughter went to school, ate, and slept alone. She's only doing this now to make up for her past mistakes.
I'm not gonna let my daughter down again.
When the daughter found out, she objected to her mother's decision. But her mind was made up as the drug was injected into her body. Her blood pressure dropped dangerously low. Just as she was about to pass out, she clung to the nurse's hand and wouldn't give up.
Clear! Sinus rhythm.
And finally, she succeeded.
It worked.
Thank you.
Phoebe was asking to talk to her dad on the phone. She didn't want to do CT and wanted to go home. But her mom said her dad was on a business trip. Dr. Manning was surprised because Phoebe's chart said her father was dead. Her mother explained that her husband had just died a few months ago. She didn't know how to explain it to her daughter. So Dr. Manning recommended Dr. Charles to help. But when he explained what he was doing, the woman said she didn't want to add to her daughter's stress and left. It was clear she was hiding something, and when the CT results came back, Phoebe's skull showed signs of healing from multiple fractures. That's why she's losing her hearing. They thought she was abusing Phoebe. She had no choice but to explain that she had lied. The girl's father wasn't dead, she just divorced him. And Phoebe got hurt a lot when she was with her ex-husband. Sprained ankles, broken arms. She thinks her ex-husband did it. But since her ex-husband was rich, she didn't have the means to outwit him. So she had no choice but to abduct her daughter. She pleaded with the doctor not to call the police. It would send Phoebe back to her ex-husband for more abuse. Since she still wasn't telling the truth, the doctor decided to report it to the Department of Family Services. Just as Phoebe's pen fell to the floor, Dr. Manning seemed to notice something. She told the girl to squeeze her fingers, but the girl couldn't after an examination. The girl was found to have genetic osteoporosis, which explains the numerous skull fractures. Phoebe had probably never been abused. And that's when the detectives arrived to take her away. She put everything on the line to protect her daughter, and now she's lost everything.
And we're sending her to jail. Couldn't she have had a doctor evaluate Phoebe before going on the run? She messed up so many lives.
The pregnant woman came to the hospital for a checkup due to burns. She insisted on doing everything she could to keep the labor natural. So even though she's 7 months pregnant, she's hardly ever been examined. But Dr. Choi recommended an ultrasound, and the results were very confusing for them.
There's no baby.
So Dr. Charles had a brief conversation and questioned her. Surprisingly, the pregnant woman didn't ask any questions about the test results, and she didn't show signs of mental illness, which means she knew she wasn't really pregnant. Dr. Charles hypothesized that anxiety was creating a hormonal response that caused her body to show signs of pregnancy. They wanted to find out why pregnancy was so important to her. So Dr. Liz N said she had a condition called pseudopregnancy, but the woman said she could feel the baby inside her. It must have been a malfunction in the testing machine. They can't accept that. But considering that her mental state is normal, so the doctors had to discharge her. In front of the hospital, the woman said she was an extreme skier before she moved, and losing the baby made her feel like she was losing herself. So maybe the pregnancy was just her way of replacing what she lost. She needed to fill in the days when she wasn't skiing.